take-home pay. And then we say, gee, I wonder why they're unhappy.
Other questions from governors?
Yeah, Governor Jindal, Governor-elect Jindal.
Thanks, Newt. Newt, I want to commend you for your work on health care. You're right. You and I have talked about it for years. I think there's a great opportunity for governors to lead because I think there's a void. I want to point out a couple of things I've heard you say before as well as today. One, when you look at the Wenberg data, we accept so much variation in health care that we would absolutely not accept in any other part of our economy, any other part of our country. You gave the Milwaukee example. I think it's completely ridiculous that we accept vastly different protocols and outcomes, variability that can't be explained away by other independent factors. The second thing that I know we've talked about is you use the example of the UPS or the FedEx man walking into a physician's office. The reality is, another way I've heard this described is we sometimes have better technology in our gift shops in the hospitals than sometimes at the bedside. We're still we're still heavily dependent on paper records. We don't have routine implementation of barcoding of drugs, of other things that we know would decrease errors, save lives. Now, I guess I'd like to give you a chance to talk a little bit more about what the states can do, because I look at the S-chip debate that happened in Congress, that's happening in Congress, and I think too often, and I'll say this, oftentimes Republicans, we try to beat something with nothing, and I think that debate absolutely missed the real important points. Instead of arguing about what the cutoff levels and the dollars, and those are important questions, there wasn't a deeper discussion of what's the best way to promote children's health. I think governors have an incredible opportunity to lead because that's not happening in Washington, and I'd like to give you a chance to comment on that and talk about what states can be and should be doing.
Well, I'm smiling because I'm thinking back, I first began plotting with Haley and with Mitch and a few others a long time ago, and trying to do things together. So I want to say this, and you guys may want to chime in a second and help us out here. I can't tell you anything which I have found more frustrating, both in the Bush administration but also in general public policy, and the gap we have between the obvious data and all of the consultants and all of the experts and all the bureaucracies in health. And I've just, frankly, it's one of the places where I've just failed. And I cannot figure out how to break out of this. And I feel like somebody has come in and said, we've got this new invention called the airplane. And we can leave California and we can actually land in Jackson the same day. But the budget director or the Congressional Budget Office or your budget director says, no, no, no. As you know, our model says that you're coming by stagecoach. And we have to score 27 days in hotels as part of the trip. And you say, now let me start again. Now what really drives me crazy is they're flying on the plane with you while you're having the discussion. And you're saying to them, let me describe reality. Now, I want to start, let me give you a couple of quick examples. Porter and Teisberg have done a terrific book on strategy in healthcare. I was just with Teisberg 2 days ago, who's at the University of Virginia Darden School. Would be glad to talk with any of you about this stuff. The gap in longevity for cystic fibrosis runs from 23 years to 47 years, depending on which center you go to. We currently tolerate a 24-year differential in Americans' likelihood of surviving with cystic fibrosis, because we have no mechanism to say to the least competent center, you have to learn. There were I don't know the exact number, a couple of heart transplant centers whose survival rate was 0. Now these are centers that only did 1 or 2. They had bad luck with those 1 or 2 because they were still studying the manual, and it was interesting and exciting. Nobody says this is crazy. I used to be the ranking Republican on the aviation subcommittee. We have very clear feelings about your life in aviation. Tim Murphy has a bill in right now, and this goes back to my scoring complaint, which is I think one of the major things that's wrong with the whole system, is that the people who are at CBO and OMB are reactionaries and are nuts, okay? They are fundamentally destructive of the system. Well, let me give you an example. Well, the head of CBO said the other day, the new head of CBO said the other day, he didn't think electronic health records would significantly save any money. Now, that means you have to deny everything you know about McDonald's, Walmart, UPS, FedEx, the whole system. To say that and act of such illiteracy that you wonder how the guy can hold the job down. And so you start with that, and it's really this bad, okay? So let me give you a couple of quick examples. Congressman Murphy, who is a psychologist, has a bill in on infection rates. Now, we kill somewhere between 44,000 and 98,000 Americans in hospitals annually by mistakes. That doesn't count infection rates. And he points out that there are some hospitals that have almost no infections and some hospitals that you're going to get infected if you're there for more than a day. And there's no system that says, gosh, these hospitals ought to get to be as good as these hospitals. In fact, you'd be considered, you'd be interfering. But if you look at the work that, and this is why the first thing I said to you was, pass a law, which is, by the way, supported by 93% of the American people, that requires the publication of price and quality data. And the first thing that will happen is that this happened to the Cleveland Clinic, which the first time they did quality data on healthcare, on heart operations, they were shocked because they came in 6th in Ohio. And the first year they said, that can't be true. And the second year they did it, they came in 6th. And they said, it still can't be true. The third year they came in 6th, they actually stopped and said, what's going wrong? And it turned out they have great heart surgeons and great operating rooms, and they had a terrible recovery department. And when you went to the recovery room, you were likely to die. But the surgeon did a great job. And it was a real crisis because the Cleveland Clinic is a high enough prestige institution that they couldn't tolerate it. So they are fundamentally redoing. In fact, one of the guys who's been their consultant is here today. So I think you first have to surface the data, and then you have a real problem as a governor, which I'm sympathetic to, and I used to run for office. And that is, some folks are not going to be happy. I mean, I shocked some people because I just co-authored an article with John Kerry saying that we ought to go to mandatory electronic prescribing over a 3 to 5 year period because electronic prescribing is the easiest first step into the electronic world. Paper prescriptions kill. We have produced a book at the center of this year. Dave Merritt was the editor, called Paper Kills, which I believe. We kill about 8,000 people a year with medication errors, which is vastly more than we kill in aviation. And the attitude is, well, you can't make my doctor. And we're having a little bit of trouble in the Senate because guys who have rural doctors are saying, gosh, I don't want to tell my rural doctors they actually have to learn how to prescribe. All these guys have BlackBerries. All these guys have cell phones. So we're going to let them kill people for a while because, it'd be politically pretty dangerous to go out there and actually say, my citizens' lives are actually important enough, I'd like you to them. So I'm just saying, I have not succeeded in this front, but I agree with you, it's doable. I would say all of you ought to get a briefing from Brent James at Intermountain Health. You ought to get a briefing from the Dartmouth Project on variants, and you ought to look at the work at Porter and Ticeburg, which is really good stuff. Haley?
I think probably it's fair to say that Levitt has actually tried to do something about this. That Levitt has tried to force electronic health records, price and quality. And in my state, we have offered, when they're ready, that we're going to take Medicaid and the state health insurance, that we're interested in being cooperative and saying, if you won't meet this standard that gives us the data to do the price and quality, then we're not going to let you get reimbursed by the state employee health insurance and all that. We're not to that point yet, but I do think it's fairness to one of our former colleagues, Mike, that he is trying to do something about this. I don't know what kind of cooperation he's getting.
Let me build on that. I mean, first of all, I should have said earlier, the great period of our innovation when I was Speaker, which you helped lead as Chairman of the RNC, and without you we wouldn't have become a majority, really was driven by Engler, Thompson, and Levitt. I mean, their ability as governors, this is why coming here is really important to me. The things they did that were innovative in the 90s and in the late 80s and early 90s were the baseline for all the innovation we did. And we actually, when I was Speaker, had their welfare directors in the room writing the bill. Because it was the only time I know of in modern history where you actually had the state welfare director sitting with the federal legislative drafters, writing it together, being approved simultaneously by 3 governors as well as the leadership of the House. And so I do want to say governors can play enormous roles in creating the wave of reform of the next 20 years. The second point I make about Mike, and this was also true of Tommy, by the way, if you ask Tommy Thompson, an old dear friend of ours, who had said every correct thing at HHS. And by the way, the president tended to say every correct thing. And one of the reasons I'm so upset about OMB, and Mitch may want to comment later,